Okay, so let me talk about two of the most serious types of calls that we encounter. Number one, heart attack. A heart attack is a leading cause of death in the United States. About 1.2 million heart attacks a year in the United States. And about a third of those, 300-something thousand, result in sudden stoppage of the heart. The other 2/3, people have symptoms of the disease and often deny it and don't seek help in a timely manner. Heart attack is acute myocardial infarction. That fancy name means a portion of your heart muscle is beginning to or has died. It could be so small, you don't even know it. People have gone to the doctor for a regular checkup. He does an EKG, says, gee, there's some changes here, and you've had a problem. And, well, I don't really feel anything. But most cases, a person has symptoms of the disease. The most common symptom is chest pressure, tightness, squeezing, uncomfortable, dull, aching sensation. Anywhere above the navel, from the upper belly, the chest, the shoulders, the arms, the neck, the back, anywhere above the navel, they can have this discomfort. You notice I did not describe it as pain. Pain is usually thought of as a sharp stabbing feeling. A heart attack is usually not that. The second most common symptom, shortness of breath. It's hard for me to breathe. I can't breathe. I can't catch my breath. Those are the two most common symptoms. Other symptoms that may or may not occur. Lightheadedness, weakness, tiredness, sitting in an air-conditioned room, breaking out in a cold, clammy, pale sweat. I just don't feel well. You know, my shoulder's been sore. I've had this gnawing toothache for a week now. You know, all the other associated type feelings that they don't normally have are possible symptoms of a heart attack, along with chest pressure and shortness of breath. Denial. Denial, denial, denial. What is this person going to say? It's not me. I'm too young to have a heart attack. I'm too healthy to have a heart attack. It's my wife's cooking. You name it, I've heard it. What should we do? And this is American Heart Association guidelines. This is not Collier County EMS. The American Heart Association says when a person has these symptoms, number one, stop their activity. If they're eating, if they're drinking, if they're pacing, if they're walking, if they're working, if they're exercising, stop the activity, number one. Number two, if the symptoms persist for more than 3 to 5 minutes, call 911. The average person waits 5 hours before they seek help. Average is 5 hours. Yeah, it started last night when I was watching Jeopardy, and I just didn't sleep all night long, and you know, I got some free time now. I think I'll get it checked out. You know, a heart attack doesn't always stop someone in their tracks. Sometimes they go about their business, finish their golf round, or whatever they're doing. So, but American Heart recommendation, 5 minutes of this discomfort, 911 should be called. Now, this is a new onset. This is someone who's never had these symptoms before. There are several things, illnesses that people may have that mimic a heart attack. They get evaluated for them. Yes, I have gastritis, and every time I have pepperoni pizza, you know, I feel I take a Tums, I'm okay. Perfectly fine. You don't call 911 in those circumstances. But new onset, never had these symptoms before. Nitroglycerin. People who have angina. Angina means pain. Angina pectoris, pain in your chest. Because you have a narrowing or tightening of your arteries. You take your nitroglycerin, which is a vasodilator, opens up your vessels. Your pain goes away. It's not a reason to call 911. Perfectly normal for you. Remember, with angina, the person should be doing what when they take it? Stop the activity. And? Sitting down, because it can lower the blood pressure. We don't want them taking it and passing out. And it is given underneath the tongue. The problem we have with nitroglycerin is, you know, people carry this bottle of pills around them wherever they go, and they're out at the beach, and they're out, you know, walking, and the heat and the light affects their how strong they are. Many times they'll take 2 or 3 of their own and it does nothing for them. We give them one of ours and the pain goes away.
They just get older out of...
Yeah, well, they're very sensitive to light and heat.
Oh.
So if they carry them with them everywhere they go, and this is Florida, a lot of times they're deactivated per se from how long they've been carried around for.
Yeah, just an example, I carry Aleve in my golf bag, the liquid gels, and I learned not to use the liquid gels because they just accumulate in a glob. You can't get them out of the bottle, you can't separate them. So I think that's a prime example of what would happen.
Yeah, and heat and light affects a lot of our medications. The other point of a heart attack, people often ask about aspirin. The American Heart Association now endorses the use of aspirin if a person is having these symptoms and they don't have allergies to aspirin. Some of the worst anaphylactic cases I've had are from aspirin. So we make sure this person doesn't have allergies to aspirin. We can help them take aspirin. I'm going to be honest with you. Well, how should you take the aspirin? For uncoated baby aspirin should be chewed. This is after 911's been called. Always call 911 first. The American Heart Association says if you have aspirin readily available, give 4 baby aspirin uncoated, chew, just have them chew it in their mouth, let it dissolve. It'll get back to your heart within a few minutes. What does aspirin do? People call it a blood thinner. Well, no, it just reduces your clotting factors. So if a blood clot has stuck in your heart, it's one of the things that prevents it from getting any bigger, any worse. Doesn't make it go away. You're not cured with aspirin. You still have to go to the hospital. It's just one of the things that prevents it from getting worse. I'll be honest. I don't even have baby aspirin in my own house. We're not that far away as paramedics. That 6 or 8 minutes, whatever it takes for help to get there, they'll evaluate, they'll give the aspirin, fresh aspirin. We throw aspirin out every month, put a new bottle in there. So it's not a life-saving thing like the commercial may lead you to believe. If you have it readily available, American Heart does endorse it. I wouldn't be running out and buying it.
Is there if there's a brain bleed, don't give aspirin?
Yes. Yeah, we'll talk about that next.
Okay.
And I've also been told not to take it since I'm on blood thinner.
Well, yeah, a good point. And that's generic. Again, first time onset symptoms, never had this before. If your doctor recommends you do or don't do something, obviously your physician recommendation always comes first for any condition you have. So always follow his advice first. He knows you better than anybody else. So whatever that recommendation is, follow that first.